Naongelelea ugonjwa wa haemophilia ambao kati ya mtu mmoja, kati ya watu 10,000 mmoja anaugua ugonjwa wa haemophilia. Na leo hii tutaweza kujua dalili zake, causes zake, labda treatment yake na management yake. Na leo tuko na mgeni kwenye studio ambaye ataweza kutueleza mengi zaidi kuhusu ugonjwa wa haemophilia. Mgeni wetu, karibu kwenye studio zetu za leo. Naomba tueleze jina lako and what are you doing?
Asante sana for having me.
Okay.
Naitwa Jael Wanjiko. I'm a lab specialist, final year student. Yes.
Okay. When we talk about haemophilia, what are we talking about?
So tukiongea about haemophilia, just blood. It's a disorder of the blood. And it means that for the patients who have haemophilia, their blood doesn't clot normally. So what that means is, kawaida mtu akijikata, the blood clots and the bleeding stops. But for the patients who have haemophilia, their bleeding takes longer. Yes. So wao hawaachi ku bleed. Yeah, it takes longer than normal. So that's just what haemophilia is.
Okay. And what are the causes of haemophilia sasa?
Okay, so probably tunaweza anza na kujua how normally ina happen for someone to have their blood clotting. Kawaida, if I would use an example, if pipe yako imeburst, most of the time you first patch it kidogo before utafute kitu ishone vizuri ama uite fundi. So it's kind of the same way that the body does. So once someone is injured, it needs a primary plug kwanza, alafu inaishonelea juu. So the primary plug inakuanga ya some cells called the platelets. So once you bleed, zinakuwa sticky, zinakaa glue. Zinaenda hapo where you're bleeding. And then after they've formed the primary plug, there are some things in blood, some proteins we call clotting factors. So the way they function is, sijui kama Juliet ulicheza ile mchezo ya tap, and then the other person taps, the other person taps, in a circle ya watoto. So that's what it does. Kuna protein A, inactivate protein B, inactivate protein C, inactivate protein D. So they are usually given numbers. So we have like 12 of them, 13, sorry. And one of the factors that needs to be activated in that CAP process, ndio sasa iweze kushona the secondary one, is two factors. We have two factors, factor 8 and factor 9. So haemophilia happens when one of these factors is not there. So unapata when it's activating, kama kitu haiko, it means yenye unashona uko mwisho haitamalizia, right? So it means hataweza kuform that meshwork hapo juu ya hiyo clot, juu ya hiyo glue, the platelets, haitaweza kuform the clot. And so huyo mtu hataacha kubleed. It will just continue bleeding and bleeding. So a deficiency in these factors, either the quality of the factors ama in numbers, when they are low, the person is hemophilic. Yes.
Okay. So what are the signs and symptoms of haemophilia?
Okay. So signs and symptoms. Let's start by saying it depends on the severity of the disease. Because I think I forgot to mention, haemophilia is a genetic disease. So that means it is passed from a mother to a child. So according to how severe the mutation kwa jini yako iko, if I would take us back kiasi, let's talk of the how that genetic happens so that we can understand more later on the signs and symptoms. For the human beings, we have 2 sex chromosomes. So for the females, wakona X mbili, but the male akona X and a Y chromosome. So what happens is, when now the male and the female sex chromosomes, the parent gives one, the mother one, the father one. And because this mutation that happens in haemophilia specifically is X-linked, what does that mean? Shida iko kwa the X chromosome. So if the boy, the child to be born, akona the X chromosome from the mother, yenye ikona that defect in the gene that codes for these proteins that we talked about. Kama iko na shida, so that means that the baby will automatically be hemophilic. So the differences in mutations are different. So that means the disease will present differently in the people. Utapata wengine wako na clotting factor mingi, wengine wako na kidogo. So according to the amount of clotting factor, tunawaeka kama kuna wenye wana bleed severely, au ni wenye wako na below 1% of the factor. Then kuna the moderate au wako katikati. They are between 1 and 5%. And then we have just hata wamekaribia normal people. That's between 5 and 40%. So what happens is it will depend with severity now. So for the people who have less than 1%, they have spontaneous bleeding. What do I mean? Wanna bleed too, like internally. They don't need to be hit for them to bleed, unlike the mild bleeders. So some of the signs and symptoms, like now for example, is the spontaneous internal bleeding. So that happens kwa joints, mostly the elbow. We have the knee and the ankle. And then we have bleeding kwa muscles. Then bruising under the skin. For watu light skin, you can see the guys who are light, they'll have a red patch. I think you've seen that in some people. So that happens. Bruising, easy bruising. We have blood in urine. Definitely, because these guys are bleeding. And then if they are injured, they will definitely bleed for long. Even a simple cut, like here kisu, will make them bleed and bleed and bleed. When they undergo dental procedures, kungolewa meno, you find that these kids will bleed longer than normal. Because now the cascade haiko, it's called a cascade, iyo ya ku activate. It's iko na shida. Yes. So those are some of the signs and symptoms. And then you will find sasa kwa joints, because I've said you are going to have bleeding into joints, you will find that the joints may swell, and then they are painful, because after swelling, itafinyilia nerves zake. So they'll have problems moving their joints. So those are some of the signs and symptoms.
Okay, and what is acquired hemophilia?
Oh yeah, thank you. So I think I've mentioned about genetic part of hemophilia, where the child gets the gene, the X chromosome has a defect. You can also have acquired hemophilia. Acquired hemophilia is where you find the mother didn't have, or the father was not hemophilic. Sorry, the mother, not the father. The mother was not hemophilic, but the child is hemophilic. The mother didn't have that defective gene, but the child is. So most of the time it's caused by autoimmune conditions. So what that means is your body is attacking these proteins itself, you know, because the white cells are built to, I see a foreign substance, I see kitu sijui, so I'll attack it. But now, what they do now is they start attacking these factors, and so when they attack their own factors, definitely zitaisha, yes, and this person again becomes hemophilic. Some autoimmune, ninini kama, even in pregnancy, cancer, and some autoimmune diseases, yes.
Okay, we are taking a short commercial break, but tukirudi utatueleza why is hemophilia rare in female.
Okay.